Hello everyone, welcome to today's webinar. My name is Layla Moomin and I am the Community Engagement Coordinator for the Canadian Cancer Survivor Network. Thank you for attending today's webinar entitled Your Advocacy Toolkit. CCSN is pleased to welcome Ryan Clark, President and Founder of Advocacy Solutions. He helps advocates synthesize advocacy campaigns, amplify campaign messaging, and engage and influence key decision makers through the development and implementation of impactful advocacy strategies. Since founding the practice in 2003, Ryan has spoken about advocacy across Canada and internationally, teaching and training thousands of people how to make their voices heard. In this webinar, Ryan will introduce the concept of an advocacy toolkit and explain the changes to advocacy during COVID-19. At the end of the presentation, Ryan will answer your questions. However, at any time during the presentation, please feel free to type your questions into the window at the bottom right of your screen. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you would like to learn more about CCSN, please visit us at our website at survivornet.ca. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided in your registration. Now I will turn things over to our presenter. Welcome, Ryan.
Thanks, Layla, and good afternoon, everybody. So here is our agenda for today. We'll go through the webinar outcomes in just a moment, a bit of background, just a slide or two, and then we'll get into the actual content of the Advocacy Toolkit. I'm very excited to give this presentation. As many of you may know, we often give these presentations at CCSN on various topics on a rotating basis, once every 2, 3, sometimes even every 4 years. And the last time we did this one, I believe, was in 2016. And when I went back and looked at that presentation, everything had changed. And so I'm very excited, as I said, to provide you with really what is, in essence, a brand new and up-to-date presentation on all of this content. So again, here are our webinar outcomes. You'll be introduced to the concept of a toolkit. We'll take you through a series of advocacy tools for inclusion in that toolkit. And then very much so, a big theme of this will be how the toolkits have evolved in the past few months with COVID-19. So just by way of background, for those of you who joined us on the webinar back in September, you'll recall this slide and where advocacy tools fit in within the context of developing an effective advocacy plan. So we talked about a 5-step process: identify your issues, test and frame your issues, develop your key messages, determine your one ask, and then number 5 is where we're really going to focus today: choosing your advocacy tools and your targets. So in that presentation from back in September, you may also recall this slide in which we went through and I gave you an example on this slide of some of the advocacy tools, but we didn't go into a lot of detail because, of course, we knew we had this presentation coming up. So here's a list of some of the more common advocacy tools we typically use. An advocacy toolkit is simply the collection of advocacy tools that you or your organization choose to use to communicate your key messages and your one ask in the context of a given advocacy campaign. And while there's no set order as to when to use the various advocacy tools at your disposal, timing is important, and I will address that with each tool I review. But ultimately, you want to create this layering effect over time. I've mentioned this previously. And that takes planning in the composition of what you choose to include in any given advocacy toolkit. So the 6 tools you see highlighted are the ones I'm going to review today. And just a reminder that next month we're going to devote an entire webinar on in-person virtual meetings with your elected representatives. So that third one on the left-hand side that isn't highlighted because we're going to do it next month. But the 6 that are highlighted are the ones that we're going to go through. So just before I leave this slide, again, an advocacy toolkit is simply the various tools that you're using at a given time. The composition of that toolkit will change over time as you go through your advocacy campaign, particularly if it's a campaign that lasts some period of time, for example, years. You're inevitably going to evolve in the context of which tools you use. And then the tools themselves will change as you go along in your advocacy campaign, kind of thing. Okay, so let's start with the first one. Letters, emails, and texts. And although it might seem really obvious to you about what these are and why we use them, I want to talk to you about them in a little bit more detail for just a bit, because in particular around COVID-19, and because there are a few points that I want to make sure that we cover off. Letters are often used to launch an advocacy campaign. So an organization sends letters out to a number of elected officials introducing themselves and asking for meetings, for example. And then they're used periodically throughout the campaign as required. Emails should be your primary form of written contact with decision makers from start to finish in any advocacy campaign, all of your advocacy work. But keep them brief and still try to write in coherent sentences. That's a really important point. Texts should only be used where you have the consent of the decision maker to text them. Don't send unsolicited text to politicians or bureaucrats. That's a really bad idea. And all three have become of even greater importance during COVID-19 with the inability to meet in person. So 3 different forms of communication, but as I've outlined, we use them in three very different ways. With respect to letters specifically, there we go. I want to highlight that because again, letters are often the kickoff to a campaign, but I find that a lot of people don't use letters the way they should be used, particularly versus emails. So the only critical question you need to ask yourself when you're composing a letter to a decision maker is, what is the purpose of this letter? Why am I writing to this person? And depending on the answer to that question, we tend to counsel that it should be no more than 2 pages. If you have more than 2 pages of written content that you want to communicate or need to communicate, use another format. There are much more pleasing formats for a reader than reading just page after page of text in a letter. And a position paper, for example, is something that you could use if you've got more information you want to communicate. Your one ask should be mentioned in both the first and last paragraphs of any letter, so basic structure of a letter. And if the purpose of the letter is to get a meeting with the reader, then every word should serve that purpose. So the example that we often use is somebody will write a letter and the purpose will be to ask for a meeting. But first of all, sometimes they don't even actually make the ask. But aside from that, they lay out their entire case or their entire problem and everything related to it in this letter. That's not going to help you get the meeting. You're going to have time in the meeting to lay out your case. You don't need to lay out your case in the letter to get the meeting. You just need to lay out what you need to lay out to get the meeting. So if the ask of your letter is to get a meeting, then every single thing should drive towards that. So we talked about the fact that you need to choose your words carefully. Words matter in the context of letters. As with your key messages, the content should be clear, compelling, concise, and consistent. I mentioned this on the last webinar. Every word in your letter should be clear, compelling, concise, and presumably consistent. You're not going to say something at the beginning of the letter that contradicts what you say at the end of the letter. I will tell you there's nothing more frustrating as a reader than reading a letter and having no idea why this person has written you the letter. So again, this idea of what is the purpose of the letter, what is your ask? Put the ask in the first paragraph, repeat it in the last paragraph. And always assume with letters, emails, and texts, and this is a very important point, always assume that your words are going out into the public domain. You may be writing a letter or an email or a text to a decision maker. It may be seemingly a private conversation, but you can't assume that. The test that I personally use, and you may find the test to be unreasonable, but the test that I personally use is I will not write anything in a letter or an email or a text in the context of our work that I'm not prepared to read on the cover of the Toronto Star tomorrow morning. Because you don't know who's going to get it, you don't know who's going to read it, and you don't know where it's going to end up. So keep in mind that all written communication, electronic or otherwise, should have that kind of frame of mind around it, that it could end up somewhere, someplace in the public domain. So let's move on to something called collective letters. Collective letters are usually used with groups of healthcare professionals, so physicians, for example, when they want to make their voice heard in a unified manner to a decision maker in government around an issue of significance. However, they can certainly be done with patients and caregivers. When designing collective letters, we follow a 4-step process to get them completed and delivered, and I'll walk you through that. And patient groups can also act as the conduit for managing this process on behalf of the physicians or other healthcare professionals. And that's why I want to share it with you, particularly on this call today. One of the easiest advocacy actions a clinician can be asked to take is to sign a collective letter. The one ask in a collective letter is often a now virtual meeting request with the recipient on behalf of the clinician community to more fully discuss the clinical issue outlined in the letter. The key to collective letters is to get as many people as possible to sign on. And if you are in a patient group and you're going to facilitate one of these, their use needs to align with your work and are always, or I should say typically, not always, utilized midway through a campaign, not at the very beginning, not at the very end, but as you're kind of going along. Again, the use of collective letters has only grown during the pandemic. Okay, so I'm going to go through with you the mechanics of these collective letters. And I've never shared this level of detail before in any of these previous presentations. So I'm pleased to take you through this. So the first step you need to do is to find your co-leads and the people who are going to draft this collective letter. You need to find a clinician to serve as the lead and ideally draft the collective letter, or unless you work with a medical writer, and some organizations do. Then a co-lead should be found, ideally from a different part of the country or the province. There's no mystery to this. It's pretty straightforward. If you're doing a national collective letter, you would want a physician, for example, from Ontario and one from Alberta, or one from BC and one from Quebec, or whatever it may be. And then even within the province of Alberta, you might want a clinician from Edmonton and another one from Calgary, and so on and so on across the country. The co-lead should review the letter and provide further input, after which time the text is finalized and put on the clinician's letterhead with both e-signatures. I realize this is a lot of detail, but there is a way to do this that has the maximum impact, and that's why I want to share this level of content with you. Regardless of the recipient of the collective letter, don't forget to CC other key decision makers. So if the collective letter is going to a provincial minister of health, you may want to CC that minister's deputy minister, for example. Second step, you want to disseminate the now completed collective letter to the clinician's colleagues, other physicians. The strength of any collective letter, as I said, is grounded in the ability of the co-leads to get as many colleagues as possible to sign on or to endorse the document. So you'll need a current list of potential clinician endorsers, including their email addresses. And the ideal number of endorsers will really depend on how many clinicians you send out to. But a response rate of 20 to 25% is considered quite good. So if you have 100 email addresses of clinicians that you want to sign your collective letter, and 20 to 25 of them sign it, you've done really well. If you get above 25, you're getting into pretty exceptional territory. I've never seen anything past 50. I'm not saying it's not possible, but that would be quite extraordinary. Also keep in mind, if you're in a rare disease and there are only 8 treaters across the country, you might get all 8 to sign it. That would be terrific. You might get 6 of them, that kind of thing. So depending on the pool of clinicians, I'm giving you a rough percentage that is successful. But if you're getting down to really, really small numbers of clinicians, treaters and stuff like that, you would hope that, for example, 6 out of 8 would sign it, or 12 out of 16 would sign it, or something like that. And the gathering of endorsements is typically done through an online survey tool like MailChimp. So the way this works is 2 outreach emails need to be drafted and sent by the lead clinician to his or her colleagues. The first one, explaining the issue at hand, also asks people to review the collective letter and then asks them to endorse it or to sign on to the document by providing their name, credentials, affiliations, and their location of practice. And we usually give people about 7 to 14 days to sign on in the first push of the collective letter. Note that the clinicians who this is sent out to are not being asked to review the letter, edit the letter, make any changes. It's a static document. It's a yes or no proposition. I mean, the questions are basically, did you read the letter? Do you agree with the letter? Do you want to endorse the letter? And if the answer to any of those questions is no, then they shouldn't be included. The second email comes close to the end of that 7 to 14 day period, thanking those who have responded and asking those who have not endorsed the letter to do so by the deadline. And always remember to put in a deadline. Note that actual signatures from the endorsers are not required, nor are the endorsers, as I said, asked to comment on the letter. Step 3 and step 4. Step 3 is compiling the list of endorsers. So as the responses from the endorsers are received, a Word document should be prepared, listing everyone in alphabetical order that will follow the end of the letter. It will be appended to the letter that goes into the decision maker. And then once all of those names and all that information is compiled and the final letter is created, then you want to send the letter to the recipient. You do that by having typically the lead clinician, again on her letterhead, on behalf of everybody, send it into the primary recipient, let's say a Minister of Health, through a PDF, and then copying everybody who has been CC'd accordingly on the letter. Okay, so that's collective letters. Let's move on now to something we call advocacy packages. Advocacy packages are a staple of the work that we do, and were actually created by Advocacy Solutions to address a gap in the ability of individuals to make their voices heard through a simple, easy to use tool. So this is a grassroots advocacy tool. In terms of timing, they should be used early on, maybe even first, and then consistently throughout any campaign. And while we've had to make some adjustments to their use, notably no more face-to-face meetings recently, they remain largely the same as they did before the pandemic in how we use them. So on the slide, this slide, are examples of the types of documents that we often include in advocacy packages. Some of the materials are meant to be used as written. So the key facts document that you see there, the 4th bullet, is an example of a document that is meant to not be altered. While other documents that you see listed here are templates meant to be altered somewhat. So for example, the letter to the Minister of Health, the last one, is meant to be altered, and I'll walk through with you what we mean by that. So let's go through each of these items one at a time, concluding with an overview of how and when you would actually go about using an advocacy package. So the first document, and we'll call this the introduction to the advocates. Some of you may have heard me say in other advocacy webinars that a successful advocacy campaign actually has 2 big steps to it, certainly at a grassroots level. The first big step is you need to find people who are willing to be advocates. And we often use advocacy techniques to gather advocates to build the arsenal of people who will take part in our grassroots advocacy campaign. The second step, of course, is to then mobilize those people to advocate to the person to whom you're trying to compel to bring change. But a lot of people kind of forget that first step, that the first thing you need to do is gather people around you. And so this document is really designed to speak not to the person to whom you're advocating, but to the people who you want to advocate with you or for you. So this document is like your cover letter, setting the stage for the reader of this advocacy package. It really needs to grab the reader, outlining the urgency of the issue and compelling them to take action by using the advocacy package, while at the same time assuring them that it's easy to do and won't take a lot of time. And that's true. In part, in the part where you outline the contents of the advocacy package, provide a web link so that they can find their elected representative. And in the contact section, make sure to have the names, telephone numbers, and emails of at least 2 people they can contact if they have any questions about using the advocacy package. I've outlined on this second slide 3 basic forms that a letter to an elected representative can take. So the first document in your advocacy package after you introduce it is a template letter that we typically use. Now, you've got other choices here. You could have a blank sheet of paper where you just ask people to insert their own information as they reach out to their elected representative requesting a meeting. You could have a form letter in which is static and they're not allowed to change anything. It's just a strict template. Or you could have a hybrid, and this is the one that we almost always recommend. You could have a hybrid, which essentially has primarily static or consistent content, but there is an opportunity, usually between paragraph 1 and 2, for the advocate to insert some customized information, some content that is unique only to them and that only their elected representative will get from them. And so that's what we usually recommend as the format that we use. So sticking with this letter to your elected representative asking for a meeting, on this slide is a typical outline for a hybrid letter. And you'll notice, even before when I was talking about just letters in general, we follow especially when the request is for a meeting, we follow a 5-paragraph format. It doesn't need to be any more than 5 paragraphs. It really doesn't, because all you're trying to do is get a meeting. So this is a quick outline for you of the kinds of the 5 paragraphs that we will often recommend. So a couple of things of note. Number 1, always mention that you are a constituent in the first paragraph. You must tell your locally elected representative that you live in their constituency or their riding or their district. If you don't, then you don't matter to them, quite frankly. You have to make clear that you are a voter who could vote for them. Secondly, consider providing some content, some context, or an outline of what you want people to include in paragraph 2. So some instructions. So while we often recommend that paragraph 2 is a brief outline of your personal story, you have to give people maybe some direction as to, well, what kinds of things in their personal story should they consider putting in there. Thirdly, even if someone does not insert their own personal story in paragraph 2, make sure that the letter flows. So in other words, paragraph in this model that I'm showing you here, pretend paragraph 2 isn't there. Paragraph 1 needs to be able to flow into paragraph 3, even if paragraph 2 isn't there. And in the final paragraph, always be proactive and mention that you will follow up. We have a very strict rule. You never end a meeting, you never end a letter with, "I look forward to hearing from you," because you may never hear from them. So you're not just going to wait forever. we are much more keen on saying, I will be in touch shortly to arrange a time to meet. I want a meeting with you. I'm going to be proactive and I'm going to get the meeting with you. I'm not going to wait for you to let me know when you want to meet with me, because you could be waiting forever. Next piece of the package. The idea of having a meeting script outline for people to use is often crucial. Most people have never visited an elected representative before or haven't done it that often. And the more assistance that you can provide to them, the more likely they are to book an appointment. In other words, to actually do what it is that you've asked them to do in the context of this package. But as I mentioned, because this is so important, it may be worthwhile asking your members what they might need in a meeting script outline in order to make their experience better. So we have, as you'll see on the next slide, we have a sample of the kinds of meeting outlines or scripts that we put together for people, but this is by no means carved in stone. This is just a sample. If people need, if the people that you're working with need something different, give it to them. If they need something more, give it to them. If they need less, that's fine too, but you won't know unless you ask them. So here's a sample of what your meeting script outline might cover. And again, it's pretty straightforward. You want to introduce yourself, explain why you're there, and your one ask, deliver your 3 key messages, tell your personal story, review some key facts, deliver your ask again, and then engage in a dialogue to ensure that your elected representative fulfills your one ask, and then conclude by saying thank you. So the great news is, in the context of virtual meetings and the pandemic, you can be sitting in front of your computer engaging with your elected representative, and you can have this document sitting right there, right next to you, and you can be looking at it as you're going through. And it makes it very, very easy to use, even easier, quite frankly, than an in-person meeting, although we use them in in-person meetings. But people are finding that they're just terrific to have, because everything you need is right there as you go through the meeting. Next document is something we call your key facts. The importance of having a key facts sheet or a key facts document is pretty self-explanatory. So I'm not going to go into it in a whole lot of detail. The only point I will make here is that this advocacy package that we've been talking about is largely meant for your advocates to use themselves, not to hand over to a decision maker. However, this is one of 2 documents in the advocacy package that if anybody wanted to share it with a decision maker, that's fine. They can go ahead and send this document off, and it can help even potentially to focus the conversation. Next is something we call a meeting report back form. And the idea here is, again, pretty straightforward. It's the best mechanism whereby an organization can really gauge the advocacy work that's being done at the grassroots level. It also allows you to identify champions amongst the elected representatives that people meet with and fine-tune your advocacy strategy accordingly. So it's a very, very simple document that we have prepared. It takes, I doubt it takes 2 minutes to fill out, probably less. And it's simply who the person met with, when, it asks some key questions, and then the idea is to get your supporters to send you back these meeting report forms so that you have some record of what happened. I'll tell you what you're really looking for here. You're looking for what we call the extremes. So if it was a good meeting and it went well, and the MLA said that, yes, I'll write a letter to the minister and that's fine. Okay, that's great. That's good information. You know that MLAs agreed to do something and that kind of thing. But what you're really looking for are the outliers, the extremes. And the extremes are, on the one hand, the negative side, somebody who has met with their MP, for example, and had a really tough time. The MPP gave them a difficult time, challenged them on the issue, doesn't agree with them on the issue, and has no interest in helping them. You need to know that because you don't want to waste your time with that person. Don't waste your time with people who aren't going to work with you. On the other extreme, you get into a meeting or somebody gets into a meeting with somebody and they really click and they really respond. And they don't just want to write a letter, they want to do more and they want to know what else they could do. And they want to get engaged in the work. You need to know who those people are because, as I mentioned, they can be turned into champions around your campaign and your cause. You need to know that kind of thing. And so that's why the real thrust of the report back forms is to capture those extremes more than anything. If your ask is for your elected representative to write a letter to the minister or a minister, make sure that you have a draft ready for that person to use. The rationale being that if your elected representative says, yes, I'll write a letter, so the ask is, will you write a letter to the minister? And the person says, yes, I will do that. Having a draft ready will help to expedite the process and, quite frankly, offer that person no excuse or excuses for not writing the letter. And as mentioned, the format will be basically the same as the letter to your elected representative asking to meet. The content is pretty much the same, and that's by design. It's meant to be consistently the same. This is the second document, the second of two documents in an advocacy package that are meant to be given to the recipient that your supporters are meeting with. And so this is meant to go to them electronically so that they can modify it accordingly. And then finally, in terms of the content, for a letter to the minister, make sure that you write to the minister that you can affect the change. Make sure that you write to the minister that can affect the change that you require. That minister has the ability to affect the change that you require. So if it's a health issue, make sure you write to the health minister, etc. Again, I recommend a hybrid letter in most cases. And in this case, include your personal story, ask directly for the change sought, and in the first paragraph, identify yourself not as a constituent, because this is a resident of the province writing to the minister in that province, or the citizen of Canada writing to a minister in Ottawa. And so you need to just establish the fact that you are a resident of the province or a citizen of Canada or resident of Canada. Citizenship isn't really relevant, but that you're a Canadian or relevant resident of Canada and that kind of thing. So again, that the minister knows this. So the point of this letter is, up until this moment, the advocacy package is really focused on grassroots people reaching out to their locally elected representatives, which they are entitled to do, as you all know. But what some people forget is that as a resident of a province or a resident of Canada, you as an individual are also entitled to reach out directly to a minister of the Crown. And so this final document allows you, concurrently with meeting with your locally elected representatives, to also reach out to ministers directly around an issue that matters to you. And then finally, on the issue of advocacy packages, there are two keys to the successful use of these packages. One, disseminating them as wide as possible, getting them out there. And so we will often couple them with e-advocacy campaigns, which I'm going to touch on in a moment, and have them available in an e-advocacy hub for people to be able to use, to download and use very, very quickly. But you've got to get these packages out if you expect people to use them across the board in a grassroots advocacy effort. Secondly, you need to draft them so that they appeal to as wide an audience as possible. So a templated letter does not say, I am a patient with such and such condition. You don't want just patients. You don't want just caregivers. You want everybody who is impacted by the issue. And impacted is meant to be a loosely defined and subjective word. It's in the eyes of the person who's interpreting what it means to be impacted by an issue or impacted by a disease. And so make sure that they're crafted very broadly to appeal to as large a group of people as possible. The next advocacy tool in your advocacy toolkit is something we call a fact sheet, or at the same time, potentially an infographic. So a fact sheet can also be used as a standalone document outside of, for example, the key facts document that we talked about for use in an advocacy package that you disseminate. And so a fact sheet and a key facts document are essentially the same thing. But the reason why I'm bringing it up in this context is, well, we use a key facts document often in the context of an advocacy package. I want you to know that designing a standalone fact sheet, even if you're not doing an advocacy package, and using that fact sheet and disseminating that fact sheet both amongst your supporters as well as to decision makers, is something that you should consider doing, and it should be done absolutely throughout the campaign. An infographic, or infographics in general, have become a very popular way of visually depicting key messages, facts, and your one ask. And so I've given you a sample of one on the right-hand side, not in oncology, that we recently designed. Not everybody learns and retains content the same way. You all know that. And a key fact sheet is typically just text. Sometimes it might have some graphics and that sort of thing in it, but it's usually a traditional way of consuming information. An infographic, while still having text and that sort of thing, tends to be much more visual in nature, and often provides you with a great deal more latitude in how you communicate content, including key messages, facts, and even your one ask. So again, we use infographics usually relatively early on in the campaign and then throughout the campaign. But if you've never designed an infographic before or never worked with one, I would strongly suggest you consider it. They're not necessarily used in every campaign, but we seem to be using them more and more because the receptivity of the recipients tends to be quite positive. E-advocacy and social media. It's really becoming the cornerstone of any grassroots advocacy campaign. I told you that advocacy packages are often housed within the context of an e-advocacy platform. Seamless integration is really one of the key benefits to this tool, and the main reason why I think that most people use it. And so when we design our e-advocacy content, usually there are a number of different features. One is something we call a single click feature. So it allows somebody to go onto a website and with a single click send a preset message to a single politician, or sometimes even to their local representative. Secondly, a meet your elected representative feature. That's often the advocacy package that we talked about, by province. We also will have a click to tweet feature in which there are a choice of pre-populated tweets that somebody can use to target a single contact or several politicians. And then, of course, as it relates to social media, we have fully integrated content that will allow you to share on Facebook and post on LinkedIn. So when I say we use this, there's no magic. I mean, we use this, many people use it. That's not the point. The point is that these are tools, or this is a tool, a platform that I think more and more should be utilized. The tool is typically built and used right from the beginning of a campaign, and then modified throughout the campaign, unless the campaign contains no grassroots component to it. If you have a campaign, an advocacy campaign, and for whatever reason, and it happens sometimes, there is no grassroots component, meaning that you don't need to have all of your supporters, you don't need to have people out there sort of doing something, you don't need this tool. don't use this tool. It's useless to you if you're not running a grassroots advocacy campaign. If it's a very targeted campaign where just a small group of you, let's say just an executive director and maybe some board members of an organization, are going out and doing a select group of things targeting one or two people in government, you don't need this tool, kind of thing. Again, with COVID-19, the demand for e-advocacy integrated with social media, particularly when integrated with social media, has only grown. So I'm not sure how well you can see this. I hope you can see it, but here's an example of what we've been talking about, an e-advocacy platform with an integrated social media component. This is from a patient group. You can see at the top, this is a live campaign that's going on right now. And so essentially you come to this website and you click on your province, depending on where you live. It takes you into your province. It provides you with content that is specific to your province. But then you can also see that it gives you the chance to tweet to decision makers and share through Facebook on your network. So just this one page alone really represents a fully integrated grassroots advocacy campaign that can be very, very easily and effectively utilized with your supporters. And then finally, this is our last advocacy tool, and it's advocacy days, virtual advocacy days. So in a previous version of this presentation, I typically spent quite a bit of time talking about how to organize an event or a day at a provincial legislature, for example. Well, that's all changed because of the pandemic. So we've switched to what we're calling virtual advocacy days. What hasn't changed is the rationale and timing for using this tool, especially when you need to do a lot of awareness building around your issue or around your organization. We recommend doing a virtual advocacy day early on in the campaign and then regularly, and that's usually annually, if possible. So this is a work in progress. That's the first thing I need to tell you. I have this slide and then a second slide, and that's all I have because we really are building this as we're going. But we've come a long way, and so I want to share with you what we have and encourage you to consider using or utilizing an advocacy day if you want. First of all, an advocacy day is really a misnomer. The ones that we're currently developing are being held over several days to accommodate decision makers' schedules. So we're actually calling them advocacy weeks or an advocacy week. And that has a distinct advantage over the in-person format where it was, okay, we're coming to Queen's Park, we're all going to be there, we're going to be there one day, and we got to meet with you on that day. And if you're not around that day, MPP, then I guess we'll miss you, kind of thing. There's a lot more flexibility here. It also allows more of your supporters to participate. There's no more travel limitations, physical challenges, time away from family, work, or cost restrictions. We have had tremendous response from organizations who are really excited about the fact that what they used to do in person and all the time and the effort and the cost and expense that used to be associated with that can now be done online. It could have been done online before, but now it's accepted as being done online. Everybody expects you to do it online, and that's really exciting for a lot of organizations. And also the receptivity from politicians and bureaucrats has been equally as positive in terms of convenience and ease of use. So here are some steps that we have designed to have you consider building a virtual advocacy day. It is quite different than the steps that we outline when we talk about in-person advocacy days. It's simpler and it's easier to do, and it's not as time consuming. So quickly, you're going to need a meeting platform. You're going to need to recruit people who are willing to take part in these virtual meetings from your side, your supporters. You're going to need a target list of who you want to ask to come on to these virtual meetings. You need to send out an invite to that target list. You need to ideally use a scheduling tool embedded in your invite. When we started doing these really quickly after COVID hit, we didn't have an embedded invite tool. Now we do. It's essentially a tool whereby the elected representative gets the email requesting the meeting, and they can go in and they can click the meeting date and time they want. It's easy, simple, and then you can organize it that way. Kind of like a doodle poll sort of concept. And then, of course, you'll need to prep your attendees and develop a meeting flow document, including bios and everything you'll need to be successful in the context of your work. And that's it. I'm happy to take any questions folks may have. Thank you for listening.
Thank you so much, Ryan, for that presentation. So starting off with a couple of questions here. So if you don't receive a response right away, how long should you wait before sending a follow-up email or letter?
Generally a week. There are a couple of ways that this often plays out. So sometimes you'll send in a request and you'll get back an acknowledgement very quickly. It just says, I acknowledge the fact that you sent me this email or you sent me this letter, and I'll get back to you shortly with a more detailed response to whatever it is that you're asking for. More and more, to government's credit, you're seeing that kind of receptivity, which I think is a good thing. However, if you receive nothing like that, you just receive nothing, then after a week, it's not unreasonable for you to simply email them back and say, I just wanted to make sure that you received this. You're not at the stage where you're saying, you know, why haven't you responded or any of that kind of stuff. You're just saying, I want to make sure that you received my email kind of thing. And then after that, pretty much follow up on a weekly basis. I mean, I don't have the time to kind of take you through all the stages of how we accelerate or turn up the volume on a public official who's not responding at all to a request. But that's usually the first step, is kind of on a weekly basis, keep trying to get them to at least acknowledge that they received something from you.
Awesome, thank you. Next question, could you talk about how a collective letter written from patients differs from one written by healthcare professionals?
So it differs in a couple of ways. First of all, you're not going to be speaking to the science, if you will, or the clinical content, but rather when we do collective letters from patients and caregivers, and by the way, sometimes we separate them. We'll do a collective letter from a group of patients, we'll do a collective letter from a group of caregivers, because depending on the therapeutic area, we may have very, very different messages that we may want to convey. But essentially, in a patient collective letter, what you're really trying to do is to convey what it's like to live with such and such a disease, or what it's like to live in with such a challenge or issue or whatever it may be. So it's really it's almost like a large personal story, but on a collective basis or a representative basis. So you might say something like, most people who have such and such a condition, you know, have this side effect from medications or whatever it may be. So you're not claiming that everybody does, but you're claiming, for example, that most people do. And so sometimes we'll structure them as a day in the life of a patient, or a year in the life of a patient, and that will constitute the bulk of the content in the collective letter. But it always concludes with the same concept, which is that we need to meet with you, government, or we need to engage with you in order to resolve the issue that we're writing you about. So it's not just a long representative patient story that then ends with just nothing. It has to end with an ask, and of course that ask would be, again, to meet or to we often say enter into a sustained dialogue, or whatever whatever it may be, just like how a clinician collective letter does.
Thank you. Next question Is there anything now being processed for after treatment rehabilitation for cancer patients?
Is there anything being processed? Leila, is that what you
Yeah.
said?
Yeah, that was the question. Is there any sort of new developments there in that area? So would that be a good area for maybe a new advocacy campaign?
It could be, in particular. Any stage in cancer treatment is certainly there's certainly a possibility to build an advocacy campaign around it. And indeed, work is done consistently in oncology around all stages of disease, of treatment, et cetera. So sure, there isn't any component or element around oncology that I would suggest is not a potentially good candidate for an advocacy campaign. I hope that answers the question that was asked.
Thanks. Next question, how do we ensure that engagement continues in between campaigns?
Yeah, that's a very good question. So the short answer is that you ideally don't want in between campaigns. In other words, and this is very challenging, so I will say it this way, but I'm not suggesting it's easy to do. A campaign ends when the ask has been achieved. That's when it ends. It doesn't end when you sort of decide you don't want to do it anymore, or everybody loses interest, or you run out of money or something like that. Sometimes they do end because of those reasons. I'm not saying they don't. What I'm saying is that ideally, a campaign only ends when the ask that you're asking for is achieved. So if the ask is to amend a piece of legislation, or ensure that a medication is publicly funded, or that a diagnostic is in place, or something like that, then it ends when that occurs and not before. What is a bigger challenge is in the course of an advocacy campaign, how to keep people engaged, how to keep it going when it can be, I'm not talking about months, I'm talking about years to achieve objectives in some cases. And that's a real challenge. It's a perpetual challenge that we have in all of the work that we do, and many organizations have. And the short answer to that question is you need to keep updating your advocacy toolkit. You need to be providing updated content, updated material, updated tools, and really try to stay on the edge of what it is that can be done in order to affect the change that you require with the supporters that you have. And again, not easy to do, but that's how we do it. So in other words, if you at the beginning of a campaign say, these are the 3 advocacy tools we're going to use, and we're just going to use them as they are for the next 3 years, that's going to be tough, because the tools need to be refreshed, they need to be updated, they need to be swapped out for other tools as you're going along.
Awesome. Thank you so much for that response. So we're nearing the end of our time today, so we'll move on to wrapping up the presentation. So thank you everyone so much for attending our webinar today. CCSN would like to thank Ryan Clark for his presentation on your advocacy toolkit. Ryan will be joining us again on November 19th to provide guidance on how to hold an effective meeting with your member of parliament or provincial representative. Next week, we will be hosting part 3 of our 8-part empowerment series entitled CCSN's Remarkable Cancer Survivors Guide to A Healing Body with Dr. Rob Rutledge on Wednesday, October 14th at 12 p.m. Eastern Time. And in this presentation, he will be providing practical ways to unleash the body's healing potential through physical habits and techniques, done with an attitude of peace, love, and gratitude. We are excited about the webinars we have scheduled this fall and hope that you will be able to join us. All of our previous webinars are accessible on demand through our website at survivornet.ca and on our YouTube channel. Thank you everyone for attending, and have a great day.